What if high blood pressure isn't the real problem, but merely a symptom? What if the numbers you're seeing on the monitor are just the surface of a much more complex health puzzle? But a warning sign? A signal that something else within your body needs immediate attention and careful investigation? Like a dashboard light in your car, it signals something deeper, something hidden beneath the surface, that needs attention before it leads to more serious problems down the road. Many know hypertension or high blood pressure as a common diagnosis, a condition that affects millions worldwide. It's often blamed on lifestyle factors like diet and exercise, or simply attributed to the natural aging process. But for some individuals, those whose blood pressure remains stubbornly high despite lifestyle changes and medication, high blood pressure is actually a symptom, a consequence of another hidden underlying condition that's driving up those numbers. This is called secondary hypertension, a crucial distinction to understand, where the real issue, the true culprit behind the elevated blood pressure, lies elsewhere in the body, often in an organ or gland. Instead of just treating the numbers on the blood pressure monitor with medication, which only addresses the symptom, finding the root cause, the underlying medical condition, can lead to a cure, a resolution of the high blood pressure. Not just lifelong management of a symptom, but a genuine return to health and well-being, potentially free from medication. Ignoring this possibility means only masking the symptoms with medication, like putting a Band-Aid on a deeper wound. While the real problem, the underlying medical condition, continues to worsen, potentially leading to more serious health complications. Recognizing the possibility of secondary hypertension empowers you to take charge of your health and advocate for thorough investigation. It's especially crucial for those with very high, difficult to control, or resistant blood pressure that doesn't respond well to standard treatments, or for those who are diagnosed with hypertension at a relatively young age, without the typical risk factors. These are red flags, important clues that suggest further investigation is warranted. An invitation to dig deeper, to explore the possibility of an underlying cause that can be addressed directly. Treating the cause, rather than just the symptom, can transform your health and your life, leading to lasting improvements. Not just your blood pressure, but your overall well-being, energy levels, and quality of life. When we talk about high blood pressure, it's important to understand that not all cases are created equal. Most high blood pressure, the kind that affects the vast majority of people, is classified as primary hypertension. Primary hypertension doesn't have one single, easily identifiable cause. Instead, it arises from a complex interplay of factors, including genetics. Your family history can significantly influence your risk. Lifestyle choices also play a crucial role. And of course, age is a significant factor as well. As we get older, our blood pressure tends to rise naturally. Managing primary hypertension typically involves a combination of lifestyle changes, such as adopting a healthier diet and increasing physical activity and medication. Often, this is a lifelong commitment to managing the condition. But secondary hypertension is a different beast altogether. It's important to distinguish it from the more common primary hypertension. Unlike primary hypertension, secondary hypertension has a clear, identifiable, and often fixable underlying cause. Identifying this cause is key to effective treatment. While less common, this form still makes up a significant portion, around 5 to 10% of all hypertension cases, affecting millions of people worldwide. In cases of secondary hypertension, high blood pressure isn't the main problem, but rather a symptom, a red flag indicating the presence of another underlying medical problem. The good news is that by treating the underlying medical issue, you can sometimes completely resolve the hypertension. This offers the potential for a cure, rather than just management. So, when should you suspect secondary hypertension? If you're relatively young and develop high blood pressure, if you're over 65 and it appears suddenly, or if your blood pressure is unusually high or proves stubbornly unresponsive to standard treatments, it's crucial to raise the possibility of secondary causes with your doctor. Don't hesitate to ask specifically about it. Finding that multiple medications aren't effectively lowering your blood pressure? That's not a personal failure, but a significant clue that something else might be going on. These signs warrant a more in-depth medical investigation to uncover the root cause of the problem. Accurately understanding the difference between primary and secondary hypertension could fundamentally change your treatment approach, leading to more effective and targeted interventions. And ultimately, it could dramatically improve your health and your life. Unlike primary hypertension, which often develops gradually over time, Secondary hypertension has a specific, identifiable underlying cause. So what triggers secondary hypertension? What are the specific conditions or factors that can lead to this type of high blood pressure? The main culprits are kidney problems. Impaired kidney function can significantly impact blood pressure regulation. Hormone imbalances, stemming from various endocrine disorders, can also wreak havoc on blood pressure levels. Certain medications, both prescription and over-the-counter, can inadvertently contribute to elevated blood pressure. And sleep disorders, particularly obstructive sleep apnea, are increasingly recognized as a significant cause. Kidney diseases, such as renal artery stenosis or narrowed kidney arteries, can severely compromise blood flow and send blood pressure soaring. This narrowing forces the kidneys to release hormones that elevate blood pressure. Hormonal issues, like adrenal gland tumors that produce excess hormones or thyroid problems, whether it's an overactive or underactive thyroid, can also disrupt blood pressure control, leading to significant fluctuations and sustained hypertension. Medications like NSAIDs, decongestants, which are commonly used for pain relief and cold symptoms, or even some prescriptions, like certain antidepressants or birth control pills, can raise blood pressure sometimes significantly as a side effect. Illicit drugs, such as cocaine and amphetamines, and sleep apnea, a condition characterized by pauses in breathing during sleep, are other common causes that should be considered during diagnosis. For example, a young woman with stubborn high blood pressure that doesn't respond to typical treatments and low potassium, an electrolyte imbalance, might have a hormone-secreting adrenal tumor. Removing the tumor can cure her hypertension, eliminating the need for lifelong medication. Identifying the true cause of secondary hypertension can mean the difference between lifelong medications to manage the symptoms and a real, lasting solution that addresses the root of the problem. That's the power of looking deeper, of conducting a thorough investigation to uncover the underlying cause and provide targeted treatment. High blood pressure is often silent, but secondary hypertension can come with extra clues. Kidney issues may cause swelling, changes in urination, or fatigue. Hormonal problems might show as muscle weakness, weight changes, or unusual bruising. Thyroid disorders can cause anxiety, rapid heartbeat, or sensitivity to temperature. Loud snoring and daytime fatigue could point to sleep apnea. These symptoms are your body's red flags. If your blood pressure is hard to control and you notice these signs, talk to your doctor. Don't ignore unusual symptoms. They could be the key to solving the puzzle. When secondary hypertension is suspected, doctors become detectives. They'll review your medical history, symptoms, and all medications. Blood and urine tests check kidney function, hormone levels, and more. Imaging, like ultrasounds or CT scans, can reveal hidden problems in kidneys or glands. Each test narrows down the cause. It's a step-by-step process to find the real reason behind your high blood pressure. This approach offers hope for a solution, not just symptom control. Understanding the why is the first step to lasting health. A diagnosis of secondary hypertension is a turning point. It means the mystery is solved. Treating the root cause can normalize blood pressure, sometimes for good. Solutions might be as simple as changing a medication or as targeted as surgery or sleep apnea treatment. Listening to your body's signals and asking questions is key. Be proactive. If your blood pressure is stubborn or you have unusual symptoms, discuss secondary hypertension with your doctor. Share this knowledge. Awareness leads to better outcomes. By seeking answers, you're not just treating a number. You're reclaiming your health. Your health is in your hands.